sign grades.
Sign your grades. I do, right? Okay. So first off, which side's the right side? Which side's the left
The blue.
side?
It's
Blue.
the right.
Why?
Inverse.
Because it's deox.
Because it's receiving what?
Deoxygenated blood.
Deoxygenated blood. Okay. So what are these blood vessels here?
Superior vena cava.
And inferior vena cava. Okay. So superior and inferior vena cava. It's then going to empty into the what?
The right atrium.
Okay. What's the muscle called up in the atrium? Pectinate. Pectinate muscle. Oh, muscle. Yep, it's pectinate. Okay. So, now, remember we were talking about the SA nodes and the AV nodes? So we're talking about right in here. Do you guys see this number 32? That's your SA node. Okay? And then your AV node. So that's where we're starting the atrial contraction. Okay, it's starting right in here. Okay. So, with the superior vena cava and the inferior vena cava, those are going to empty into the right atrium. These are your pectinate muscles. Blood is then going to flow in through the tricuspid valve. Okay? Pulled shut by, these are called chordae tendineae, which mean heartstrings, which are attached to papillary muscle. Okay, you see the papillary muscle? Those are attached to it. Now, do you guys see this these ridges and stuff down here in the ventricles? These are called trabeculae carnae. Okay, trabeculae carnae means fleshy pillars. So trabeculae carnae. So we are then into the right ventricle. These are our discharge. So we have receiving chambers and discharging chambers, and then pushes it out through what? Pulmonary semilunar valve out through the pulmonary arteries. Now these branch. Okay, you have your right and your left, because remember they're going to go to your lungs. So your right and your left lungs. So these are going to branch. That's why you see these branchings. Okay? So pulmonary artery. Go to the what?
Lungs.
The lungs. Become oxygenated. It's going to come in through what?
Pulmonary veins.
Pulmonary veins. Okay? Okay, and you have more than one. So you're having these pulmonary veins. It's going to Yeah, you should be able to see them. Yeah. So it's going to empty into the left atrium. It's going to pass through what? Bicuspid or mitral valve. Which are attached to what? Which are then attached to what?
Papillary.
Papillary muscle. We're then going into what? The left
Ventricle.
ventricle. Out through the what?
Aortic.
Aortic semilunar valve. Out through the aorta. Now you should have seen branching up at the top. It's going to branch into your subclavian, your carotids, and your brachiocephalic. Okay, your brachiocephalic veins are right over here. Okay, and whenever you start your cat dissections, you're going to be responsible for those actual branchings. Okay, so right now I just want you guys to know the main ones that's coming off the heart. Okay, but like I said, once we get to cat, you're going to be responsible for all those branchings. So this way you kind of know. That's the reason when you start doing your pulse determinations, your carotid is super easy and it's super strong. Why? What's it branching off of?
So close to the aorta.
Right, it's branching off of the aorta. And the aorta is the what? It's the
Main artery.
it's that big strong artery in your body. Okay? So that's called the aortic arch.
What are they from left to right again? Subclavian, brachial.
It's brachiocephalic.
Brachiocephalic.
Then it's going to be left common carotid, and then your subclavian. Yeah. Okay. So, whenever you were trying to tell the difference between the front and the back of the heart, how could you tell? What were we looking at? You guys remember how it looked?
Intervertebral septum.
Well, you're looking with the septum's in the middle, but when you're looking for that diagonal, you guys remember that diagonal coronary blood vessel? I drew it on the board. So you have your anterior interventricular artery and vein. It's going to be kind of diagonal, right over here. And on the back, I usually tell people with the posterior one, it kind of looks like a T. See how it crosses nice and straight here? And the anterior one is going to be kind of diagonal. It's going to kind of branch. Now, I think those are the only ones I had you guys know. I don't think I asked circumflex or anything. But I want to make sure you guys know the front and the back. Okay? All right. Any questions on that? Do you guys
What was that called again? The T thing?
So when your posterior, it's posterior interventricular arteries and veins. Yes. Okay. And of course, you're going to have more. Like you're going to have the circumflex, and that's just going to be over here. And then you're going to have your left and your right arteries and coronary veins. Okay. And then like your superficial ones. These are just kind of going down to feed that cardiac muscle. Okay. All right. Do you guys feel okay? It's not so bad, right?